All right, everybody. I got 3:01, so in the interest of everybody's time, I'm going to go ahead and get started. Welcome to the very first DuPage ROSC Council meeting of 2024. My name is Jarrett Burton. I am your DuPage ROSC coordinator, and most importantly, I'm a person in long-term recovery from substance use challenges. Very glad to be here with y'all as we get into the new year. Just a couple of housekeeping things first. If you don't mind, if we can make sure everybody can keep their microphones muted unless we're speaking, so we can kind of cut down on some interruptions. That would be fantastic. In addition, we are recording today's meeting as we do, and that is for us to put up on our YouTube page. If you haven't checked it out, we put every meeting we do up on our YouTube page, so not only the ROSC Council meetings, but also the ROSC presentation series. So if you ever miss it, you know that's where you can find it. So we are recording that today. So you guys can check that out in your own time. If you don't mind, could you please put your name, organization, and contact info into the chat? This not only helps us out with attendance purposes, so we can submit that to the state, but it is also obviously a really great way for members to kind of get in contact with each other offline for projects and collaborations, referrals, you name it. And we'll be talking about referrals here in a little bit when I have Danny update us on our WhatsApp referral group. As it is 2024, and I think there are maybe a few people that might be here for the first time, I think it's good to kind of start off with what a ROSC is. So just as a primer for everybody, ROSC is a coordinated network of community-based services and supports. And this is really important, that is person-centered. And we try to build on the strengths and resiliencies of individuals, their families, and communities to not only achieve recovery, but just overall improved health, wellness, and quality of life for those people who are living with substance use challenges or maybe are at risk for them. But most importantly, you know, ROSC is a way for us to come together to kind of find ways to bridge gaps in services that are happening out here in DuPage County and the surrounding areas, and really to kind of build a recovery culture that helps and importantly empowers people that are out here with lived experience in this stuff. So that's kind of the short elevator pitch of what ROSC is. We'll obviously get more into it as we get into today's meeting, but we're glad to have everybody here with us. So usually, yeah, I just ask people to put their info in the chat as a way to connect. Is there anybody who is at a ROSC meeting for the very first time that would like to say hello? I'm looking on Zoom. I think most people have been here. Anybody here? All right, do you want to, you can do this two-way. You can yell me your name, or you can get on the mic and introduce yourself. You can yell it. You can yell it. Erica. Erica from Family Shelter Services. The new community advocate. Well, welcome. We're glad to have you. Let's give a hand for Erica. Very glad to have you with us. Anybody else here for the first time? I think everybody else is a frequent flyer. All right. Well, thank you for coming. We're glad to have you here. Now that we got that intro out of the way, I'm going to share my screen because I have a lot of upcoming meetings and trainings and things like that to share with everybody. So let me go ahead and share my screen with y'all. All right. Everybody can see that if I can get a thumbs up. All right. So real quick, just to go over today's agenda, going to preview some of these meetings and trainings. I'm going to kick it over to Danny in just a little bit. He's going to update you on what's happening with our WhatsApp referral group. If you've never heard of the WhatsApp referral group, he'll explain that. And if you want to be a part of it, he can tell you how to get involved with that. I also am going to have my colleague Danielle jump on for a little bit, who some of you know, but I'll give her a chance to introduce herself, who's been doing some social media work with us to kind of talk a little bit about that. Then we have got our guest of the month, Nicole Janssen, who's a treatment advocate at Recovery Centers of America, to talk to us about some evidence-based care for alcohol and substance use disorders. Then at the end, we always leave time for organizational updates. So what are the programs and events? And not only that, what are some needs? I think we all, as we work in these individual programs, come across times and programs where we could use some help. And I think this is a good place to kind of share those needs in a space like this. So we'll leave some time for everybody to kind of update us. We'll also update y'all on what's happening in Region 2. For those of you who don't know, DuPage County ROSC is in what's called the Region 2 of Illinois as far as ROSC go. Danny and myself are fortunate enough to do a little bit of mentoring work with other ROSs in our area. So we like to update everybody on what's going on in Northern Illinois. And then at the end, we'll be done and out of here by 4 and promote at the end a little bit about what's going on next month. But I'm going to go ahead and show you guys what's happening with DuPage ROSC here. We do have our presentation series. So for those of you who haven't attended one of these, this is different from the ROSC Council. So this is usually on the 3rd Wednesday of every month, and this is Zoom only, usually at 10 a.m. The point of the presentation series is to kind of take that hour to dig a little bit deeper into a topic kind of on the recovery continuum, maybe that's happening in DuPage or just in the Northern Illinois region. Sometimes at DuPage ROSC meetings, there's a lot of housekeeping. There's a lot of spotlighting programs. And so sometimes with the presentation, we may not get, a full hour to be able to talk or dig into the topic. So this is what we use that for. And actually next week, I'm going to be doing one about xylazine, which if you're unaware of xylazine, you've probably maybe seen it in the news or heard, health departments talking about it. It is a tranquilizer that is being cut into drug supplies, not only up here, but across the country. So I'm going to be presenting on that, not only, the history of xylazine, what it does, how it affects the body, but also some of those treatment challenges that are coming up as we see people who are presenting for treatment who maybe have been addicted to xylazine, which are very unique. I can tell you that. So we'll be covering that next week. If you're ever interested in doing a presentation for us, I love to hear pitches. If there's something that you're passionate about, if there's a topic that you're really interested in, just reach out to me. We would love to have you come and join us and talk about stuff that's happening in the recovery community up here in DuPage. For those of you who need CEUs, if you're like me, you could always use CEUs, right? We are having a presentation on February 20, presented by Nicole Behavioral Health Services, specifically about gambling disorder. So this is going to be a workshop on February 20th here at Serenity House from noon to 4:30, right here in the big hall. If you look on the screen, you see ROSC audience. This is where it'll be. People are waving. Yeah, there you go. But yeah, we're going to be offering CEUs for this. Obviously just digging into different topics around gambling disorder, something that we're hearing more and more about in the state of Illinois, and something that the state of Illinois has a lot of money to spend as far as learning about the addiction, but also how to treat it. So I'm going to post this on our Facebook, and I usually send out an email after these meetings with all of this stuff. I'll make sure I send this out to you. But definitely, if you're looking for some CEUs related to gambling, we got you. Speaking of trainings, we may have a spot or two left on our CCAR Recovery Coach Academy. This is the Connecticut Community of Addiction and Recovery. We offer this through DuPage ROSC for those of you who maybe are looking to become a recovery coach. So this is a 3 kind of weekends in a row training. You can see the schedule up there on a Friday night and then the next day on a Saturday. So that's 3 consecutive weekends. And this is a great way to kind of get your foot in the door if you're maybe somebody who does not work in the field, but you're interested in doing it. Or maybe somebody with lived experience who is, passionate about maybe getting into the field as a recovery coach. This position and particularly this position in the field keeps growing. More and more places are bringing on not only certified recovery support specialists, but peer recovery support specialists. So we're happy to offer this for you. There's a small fee related to some materials, but we'll work with you on that. Otherwise, I got some contact info up here and a QR code. So if you're interested, like I said, spots are very limited. So you may try and reach out and see if that's something that you can get signed up for, but that's coming up here in a little bit longer than a week. What else is coming up? If you're looking for some sober events, the DuPage ROSC game night. We are super excited about this. I'm going to show something on camera here, which I got through Amazon in the past week. So it's kind of blurry, but this is the DuPage ROSC Mario Kart Champion Trophy. which will be offered to obviously the Mario Kart champion of that night. But yeah, Saturday, January 27th here at Serenity House in this room, we're going to be doing a sober games night. So sometimes you can see behind me this giant screen. We're going to be running Nintendo Switch through this screen. We're also going to have some other TVs running games through that, but we'll also probably have like Uno, board games, other stuff like that. This is open to the public. I've had a few different organizations share this with their clients. Feel free to do that. We would love to have them. And I'm chomping at the bit to give that trophy away to somebody. So come and take Danny on in Mario Kart. He is talking a big game in the office. So we'd love to see you come and win that trophy. In addition, there's a sober skate event coming up. I think I said this at the last meeting. I promoted this a couple of times. So January 21st at the Coach Light Skate Center in Roselle. This is an all sober skate put on in part by our friend Mark Matthews. All proceeds for this are going to go right back into the recovery community. $10 for adults, $5 for under 18. My favorite line of this, bring your own skates. Again, if you have your own set of roller skates in 2024, God bless you, bring them to this event, or you can pay $4 for a pair of roller skates at the door. But this is usually a lot of fun. In addition to the fee that goes back into the recovery community, he's usually collecting new pairs of socks. Last year when they did this, they went above and beyond in collecting socks for our warm clothes drive that we donated to the People's Resource Center. So if you go and you want to bring a pair of socks, I'm sure they would love to collect that from you. So yeah, that's coming up on the 21st. Lastly, just real quick, Serenity House, DuPage ROSC, DuPage RCO, as an entity here. We are looking for certified recovery support specialists. So recovery coaches. So if you or somebody you know is looking to do that and work together with the ROSC and the RCO, we are looking to do that. I've shared this on our socials and I've shared this in emails and stuff. So I'll continue to do that. But we're looking for that as well as some transportation technicians. So if you're looking to come work in a pretty cool office, if I do say so, check out that QR code and maybe come and see us. So I'm going to stop sharing here for just a moment. But again, if you missed any of that stuff on those flyers, I'm going to share it after the meeting, but they're also up on our Facebook page. So let me take this down. I do want to turn it over for just a few minutes to my colleague, Danny, who I mentioned, the Mario Kart champ, to update everybody what's happening with the DuPage ROSC WhatsApp referral hub. So Danny, why don't I give it to you here for a bit and you can kind of describe what's happening with that right now.
Thanks, Jared, and good afternoon, everyone. I welcome all challengers, just saying. Here's this month's WhatsApp referral hub update. Our team is now 70 members. So that's 70. You know, this started off as a text thread between Jared and some other members of Serenity House and other organizations. And once they hit about 17 members on a text group, they saw that they couldn't really add more people due to the different, carriers between iPhones, Android. So we came up with the WhatsApp group, and now we have 70 people from different organizations throughout the United States. So awesome job, everyone. We're happy to have you. This month, we've been joined from members of the following organizations: Serenity House, Sauk Valley Voices of Recovery, Charlie Health, and New Life Behavioral Health. Over the last month, we've given referrals for detox, residential treatment, PHP with housing, IOP, virtual IOP, locations to receive Vivitrol shots and oral naltrexone, medication management, LGBTQ facilities that focus on sex addiction, and sober living. I'm going to put my email and information in the chat. If you're interested in getting more information or joining, please feel free to send me an email. There are also 2 WhatsApp referral groups outside of us that have started, one in Winnebago County and Sauk Valley that covers Ogle, DeKalb, Whiteside, and Lee County. So if you want information, feel free to send me an email.
All right, thanks, Danny. So yeah, that's been a really, really helpful tool. And I think one of the things that like we're most proud of only because of the results we've been able to get for people who really, really needed help and maybe didn't know how to navigate it. So for those of us who maybe have been seeking treatment for the first time, or maybe it's been, a huge gap in time before you've tried to maybe go back to detox or something, it can be really disheartening to hear, we don't have a bed, call back tomorrow. So we know that for those people who, especially those people who maybe are using opioids, that can be the difference between life or death, whether or not we get them in that night. So it's been a huge, huge help. So I would definitely recommend it. It's pretty non-intrusive. You can stay involved as much as you want to. But into the coming year, we're going to hopefully kind of track some results on that a little bit more, just to kind of see, hey, this is what's working. Do we need to create subgroups, for certain types of services in it? So for those of you who are already involved, thank you so much. It's been, a real success, and we hope to kind of even grow it into the new year. So thank you, Danny, for taking control of all that stuff. I do want to take a minute. Danielle, come on up. I want to introduce another colleague of mine. I'm going to give her mic number 2. This is Danielle Heffernan. She has come on board with us. It's been a couple of months, right? At this point?
Yeah, I've been full-time for about 2 months, but I was part-time since June.
Yeah. So Danielle, why don't you tell the people a little bit about yourself before we talk about the social media? So you want to give the Cliff's Notes version of you?
Of course. Hi, everybody. My name is Danielle. Can everybody hear me okay? Yeah? All right, awesome. Yeah, so I started off as a client here at Serenity House. I did what they call the senior resident position over at the women's house. Did that for a little over a year, and then they hired me on to be a recovery coach with DuPage ROSC, and I absolutely love it. I love this place. I love being a part of this place. And yeah, one of the things I've been working on since I started here was I started an Instagram page for DuPage ROSC. We're trying to get some more followers on there. So all my Instagram people, if you guys want to follow the DuPage ROSC, it's going to be a great place to hear more about what's upcoming. All the flyers that Jared showed at the beginning of the meeting, those are all on there. Good reminders. And plus we're going to be doing some fun posts. We're going to do Meet a Coach Mondays soon, where you'll get to kind of meet each of the people that work with ROSC. But yeah, the Instagram handle is DuPageCo.ROSC. So it's DuPageCo.ROSC. I'll type it in the chat as well. And again, it's DuPageCo.ROSC. Thanks.
Thank you, Danielle. And I know a lot of people are big on Instagram, so please, we're trying to build a following. I posted a really uncomfortable looking video of myself on there earlier, so maybe there'll be some more of those coming up. You never know. If anybody's out there is handy with TikTok, let me know, because I am so out of touch with what the kids are into these days. But we're trying to promote, in fun ways. So thank you to Danielle for taking control of that. So yeah, thank you again. So with the housekeeping out of the way, I do now want to turn things over to our presenter for this month, which I said is Nicole Janssen from Recovery Centers of America. Nicole has been a very, very valued member of our ROSC pretty much since the beginning, or close to it. I think, Nicole, you came on maybe 2 or 3 months after we started the ROSC. It was pretty early. And you've been here almost every month since then at almost all of our events. If you're a part of that WhatsApp referral hub, Nicole has probably helped you with something, because she is the MVP of that WhatsApp group. So yeah, she's such a valued member of the ROSC Council, and does great, amazing work. Apart from us finding services for folks over at Recovery Centers of America. And we're glad to have her here finally to present. Very passionate about the work she does. And she is here to talk to us today about some evidence-based practices for alcohol and substance use disorder. And we are also going to leave some time for questions and comments at the end. So if anybody has a question, just save it and we'll make sure that we get you there at the end. So with that out of the way, Nicole, I'm going to turn it over to you. Thank you for being here.
All right. Thank you so much for having me. Can everyone hear me okay? Awesome. So I am going to go ahead and share my screen. I do have a PowerPoint presentation. So Okay. So what I really want to talk about today is what is evidence-based treatment when we are talking about alcohol use and substance use disorder. And the reason I, asked Jared if I could present this is I actually went through this training. This was a training that my company, Recovery Centers of America, put its treatment advocates through several months ago. And what was really interesting for me was that I found a lot of the things that I was learning to be really helpful. And all I could think during that training was, gosh, I wish that I had known some of these things, when I was going through, this journey with my family. So for those of you who don't know, that I haven't had a chance to talk to about this, I am not a clinician and I am not a person with lived experience. But my experience lies in the fact that I, love someone who's in recovery. My brother struggled and has continued to struggle for a really long time with opiate use disorder. And what I have learned since entering this role is that there are lots of things that families and frankly patients don't know when it comes to seeking treatment. So when I went through the training, I just realized that I was really passionate about making sure that other people had some of this information as well. So I hope you will find it, really interesting. Even those of you who are clinicians, I hope you will walk away with a couple of key points that maybe you hadn't thought about before. And as Jarrett mentioned, certainly happy to talk more about it, at the end, or you can always contact me privately. I could probably talk for hours about this, but we don't have that much time. So without further ado, we will move forward. Okay, so like I said, why are we here? What is the goal? I really want to make substance use disorder and substance use treatment, transparent and accessible to everyone. The intent of this training is to promote, patient advocacy and help obtain better patient outcomes. I think, if we're serious about, treating substance use disorder and other mental health disorders as medical conditions, then we need to approach it the way we approach things like, hypertension and diabetes and asthma. And the way that we do that currently in the medical setting, right, is through science, is through, setting a hypothesis and doing testing to see, what medications work, what treatments work, what theories work. And so while this, of course, is always changing, and hopefully over time we will develop more, more treatments that are more effective, this training is basically talking about what we know, right now is going to help those who are seeking recovery, obtain sustained recovery. And so for different fields, people who have different relations, are going to find this information useful for different reasons. I like to think that if you're in the legal field, it could, maybe help inform sentencing guidelines, probation requirements, help employers who are trying to assist, employees who may be struggling, help them gauge an employee's readiness to return back to work, help plan for the leave of absence. But again, most importantly, help with advocacy within the healthcare system, for the patients and their families. I think what we probably all have realized, no matter what the medical issue that you have is that you really have to be your own advocate. I wish that we could say that you could rely on medical professionals to kind of hold your hand through the process of getting treatment for whatever it may be, whether it's substance use disorder or whether it's cancer. But what we know is that, those resources just aren't there, and we really have to fight for what we need in terms of, our care. So that's really my hope, is that, we can all walk away from this training and use this information to help advocate on behalf of ourselves, our loved ones, or, people that we see in our professions. Okay, so everything that we talk about today is based on what listed here are the NIDA principles of effective treatment. NIDA stands for the National Institute of Drug Addiction. And there are 13 principles of effective treatment. And as you'll see, each one of the slides that we talk about are going to kind of relate to a couple of these things. But they are, addiction is a complex but treatable disease. No single treatment is appropriate for everyone. Treatment needs to be readily available. So, right, this goes back to what Jarrett was just saying with the ROSC referral network. We need to be able to access treatment in order for it to be effective. Effective treatment attends to multiple needs. Remaining in treatment for an adequate period of time is critical. Behavioral therapies, including individual, family, or group counseling, are commonly used forms of treatment. Medications are an important element of treatment. An individual's treatment plan must be assessed continually and modified if necessary. Many drug or alcohol addicted individuals have other mental health disorders. Medically assisted detox is only the first stage of addiction treatment and by itself does little to change long-term abuse. This was one that kind of knocked me off my chair because when my family was going through the cycle with my brother, right, there were so many times that he was like, well, I just need to go to detox. And we didn't know to challenge him on that, you know. Treatment does not need to be voluntary to be effective. That was another one that was really surprising to me. And that really just means that, you know, we've heard other people in our community talk about this, like just because it's a nudge from a judge, that is a reason that you're getting treatment doesn't mean that you can't be successful in that attempt. And then the last two, drug use during treatment must be monitored, drug and alcohol use, because, you know, recurrences can happen. And so you want to make sure that the treatment team and the patient, you know, are on the same page. And then finally, treatment programs should test for other communicable diseases, HIV, TB, and that kind of goes with that principle number 4, which is, you know, you need to attend to multiple needs, not just the substance use itself. Oops. Okay, so I just want to play this short video for you guys. This is a video that we watched in our training, and it's a video that I recommend, particularly to those who are not, you know, in the clinical field. I just found it really powerful, so I hope you will too.
Scientists first began to understand addiction as a brain disorder in the 1950s. Doctors Olds and Milner, in laboratory studies of rats, found the parts of the brain affected by addiction. But then in 1994, Doctors Volkov and Shelbert, top neuroscientists, ran PET scans of the brain that showed the effects of substance use disorders. Like other diseases, these scans showed it affected tissue function. There are two main parts of the brain affected by drug use, the limbic system and the cortex. The limbic system, located deep within the brain, is responsible for our basic survival instincts. So when you do essential things to stay alive, like eat, drink, find shelter, have sex, or care for your young, your brain reinforces behaviors that cause the release of dopamine from this region. That reward for surviving is also transmitted to the amygdala and hippocampus, which records a memory of that feeling, so we seek it again. This is our survival hardwiring. Addiction also affects this area up here in the prefrontal cortex, which is what separates us from other animals. This is where decision-making and impulse control live. When drugs or alcohol are used, they activate the same dopamine process in the survival center. And when use is repeated, that substance can hijack that part of the brain. This hijacker changes the brain and weakens this system to make it believe that the primary need for survival is the drug. In hijacking the brain, it can usurp those primary motivations: food, water, shelter, sex, and protecting our young. And the hijacker needs more and more of the substance to activate the same level of reward or feeling of pleasure, causing the brain tissue to become increasingly damaged with continued drug use. There are factors that put you at higher risk for the hijacker, including individual factors like genes and age of first use, and then environmental factors like drug availability. But if the hijacker takes hold, addiction is treatable. Advancements have been made in assessments, detox, treatment programs, recovery supports, and medications to treat addiction. Brain scans show that once in recovery, the tissue in the limbic system and cortex can get better. With your help, we can expand these innovations to help millions of individuals and families and ensure that addiction is treated as the medical issue that it is.
Okay, so I hope you guys enjoyed that video. Like I said, when I first saw it, I was like, gosh, I wish someone had showed this to me 20 years ago, because I thought it really broke down what I was seeing in my family in just a really understandable way. And so the first thing we need to talk about is, what are the drivers of addiction? And it's important to note that it's not one thing for all people. It is typically some combination of biology, genetics tend to play a part, but it's not a sentence if you have a genetic component. Biology also tends to play a part in, how strong craving or withdrawal symptoms are. You also have obviously the social environment coming into play. So family dynamics, right? This is when we talk about like protective factors and risk factors, stressors in life, which we know we all have, whether or not the people around you are regularly participating in substance use. And then the psychology, the neurobiology of habituated learning, untreated mental health, which we know, plays a big role in, using substances either to self-medicate, or to, just driving additional substance use, and then, personal coping skills or lack thereof. And so I think it's really important to remember that each individual person is going to have a different mix of these things. And so every treatment is going to have to be tailored based on, how strong the biology, psychology, or social environment is. So in general, those entering treatment need at least 3 months in formal care. So formal care is what we're going to refer to as detox, inpatient or residential care, outpatient treatment such as PHP or IOP programs. So you want at least 3 months in some level of formal treatment. Now, that doesn't mean you have to necessarily go in a linear fashion. You can enter that continuum, at any stage. And it's important to note that you can also move, up through the higher levels of care and down, but just 3 months in that formal treatment. And then, at least 12 months connected to some kind of informal care. So that could be, 12-step meetings or other recovery meetings. That could be involvement with, an alumni association, other sober events like we were just talking about. That could be individual therapy. So that's not going to look the same for everyone, but patients tend to see the best outcomes in terms of sustained recovery when they have at least 3 months in formal treatment, 12 months connected to some kind of care. It's also very common that patients are going to require more than one episode of formal care. So if this is something we know up front, this is something we can share with families, with patients. Hopefully it takes some of the shock and surprise out of it when there is a recurrence. And then obviously, this just goes into the full continuum of care. So making sure that the patient has access to all those different levels and all those different things that we just talked about. So again, not everyone's going to follow the same path, but just making sure that they have options to continue in their care. So again, recovery starts when people enter care, regardless of what level that is. But some examples of care are the inpatient services, like we talked about, detox.
Your call will be answered in the order that it's received. Please continue to hold or press 2 to leave a message.
Donna, I'm going to mute you. All right, go ahead, Nicole.
That's okay. It's going to, recovery is going to include ongoing outpatient services, obviously peer recovery support, that's super important, we know, as well as alumni services and activities. So again, whatever we can do to make sure that the patient can be connected for as long as possible. So again, support groups, you know, everyone kind of immediately thinks of 12-step, AA, NA, and those are obviously very important in recovery, but they're not the only programs available. And so something that I like to emphasize is, you know, if you go to an AA meeting or an NA meeting and you don't like it, try another one. You know, maybe it's just that particular, you know, time, place, mix of people. You can find, you know, now more than ever, meetings that have a different makeup. So, you know, I wouldn't necessarily give up on it, but if truly 12 steps is not resonating, then there are so many other things that you can try. So this is just a listing of some of those. There's Smart Recovery, Celebrate Recovery, Refuge. You know, typically you can find meetings that are, you know, women only, men only, meetings that, you know, are for LGBTQ plus, you know, really anything that is important to you, you can really find a meeting for these days. So kind of, you know, no excuse not to continue that, to continue that informal care. Okay, so then the other part to treatment that's, you know, gaining more popularity is medication-assisted treatment. Or MAT. This is just a breakdown of what we see our patients coming to treatment for at RCA. I would imagine other treatment centers, you know, may see a similar mix. I think what's really interesting about it is, you know, opioid use gets kind of all of the attention in the media. And, you know, we can talk about why that is. Obviously, it tends to be more dangerous. But 63% of the patients that we see are actually struggling with alcohol. And so I think that's really interesting because when we hear people say, oh, I don't know anyone who, you know, struggles with drug addiction, or I don't, you know, I would never need to go to residential care because that's only for, you know, people who struggle with drugs, with opiates. It's actually, you know, that the data does not prove that to be the case, that the majority of people are actually struggling with alcohol. And so I think, you know, for me, that what really stood out about that, that was something that was really surprising to me. But what it kind of triggered for me was, you know, even if you have someone in your life who maybe just has some problematic use around alcohol or around other substances, frankly, you know, marijuana, nicotine, whatever it is, you can still have this conversation about, you know, whether or not some sort of intervention is right for them. So whether it's peer support, whether it's, you know, a 12-step meeting, like I said, whether it's individual therapy, you can start somewhere, and hopefully then, you know, that person doesn't have to get to the place of needing those higher levels of treatment. But importantly, there are medications available. So just like with some of these other chronic diseases that, you know, I mentioned earlier, things like hypertension, asthma, diabetes, we know that lifestyle changes can help with those, but we also know that for some folks, that's not enough. And so, you know, that's where medications come in. And what's so interesting to me is that in those cases, you know, we may acknowledge that someone's lifestyle choices you know, have contributed to the severity of their disease, to the severity of their asthma or their diabetes or their hypertension. But, you know, typically we're not shaming them for that. And so, you know, my hope is that soon the same can be said for alcohol use and substance use disorder. So while most of the medications that are out there are really for opioid use disorder, there are some that can help with alcohol use disorder as well. These are FDA approved medications. They typically help reduce cravings so that patients can focus on recovery. They can help manage other uncomfortable withdrawal symptoms. I think if you are a person who's in recovery or you've known someone who is close to you that's in recovery, you know that withdrawal can be very scary, and it can sometimes prevent people from wanting to take that first step. It's, you know, sometimes, yes, it can be fatally dangerous, but oftentimes, at the very least, it's extremely uncomfortable. So there are medications that can help with that. There are medications that can limit the effects of opioids and reduce overdose fatalities. And in the end, right, it's about keeping the patient alive so that they can try and get the treatment and work towards the meaningful recovery that we're hoping for. Some of those common medications include buprenorphine, methadone, and naltrexone. And there are a lot of myths around medication-assisted treatment. There are a lot of people who feel like, you know, that 12 steps and sobriety is the only way. You know, a lot of the things we hear are, it's just replacing one drug for another. You'll have to take that drug for the rest of your life. You know, people will just sell their medications to go back into substance use. And all of these things have been, you know, proven untrue. These medications are very well regulated. You know, so, you know, really, it's just not, the science and the data does not bear out that anyone is selling these medications. It also, science does not show that people have to take the drug for the rest of their life. Some people take it long-term. Some people take it short-term. Again, it's a very individual process. And, you know, whether, you know, it's truly just replacing one drug for another, I don't think we would say that when we talk about antidepressants or hypertension medication or, you know, someone who's taking insulin. Well, yeah, they're using, you know, insulin replacement because their body can't produce their own. And yet we don't, you know, we don't shame them for that. So medication-assisted treatment more and more has been proven to be really effective in treating different substance use disorders. And then the other thing that's really important is what we call the therapeutic alliance. So just going to any therapist isn't necessarily going to, you know, help affect change. Obviously, therapy is very personal and intimate. Trust is a huge component. If you don't feel like you can connect with your therapist or that your therapist understands, you know, the challenges that you're having, then it's not going to be effective. And so it's really important to make sure that when you're looking for someone for yourself or someone for, you know, someone that you're working with, that it's going to be a good fit so that maybe they have a similar belief system, you know, that, you know, if you're trying to treat someone for, you know, alcohol or substance use disorder, then obviously, you know, you might want to start by looking for someone who has experience with those things. You know, Roger, I think, is on this chat or on this call. And one thing I asked him was, you know, what was something that he wished his family had known, you know, when their son was going through his addiction. And one thing that he shared with me was he wished he had known that it wasn't enough to just pick someone who, you know, said, oh, I have experience with addiction. That really it would have been more helpful to pick someone who specifically had experience with opiate addiction. And, you know, so if the first person that you come across, you know, it isn't a right fit, then you can keep trying. And really, you shouldn't be afraid to, you know, tell a therapist if it's not the right fit, that it's not working. Because at the end of the day, you know, your health is what's most important. I remember going to a therapist who the only thing he would ever say to me was, well, you need to practice mindfulness. And it made me want to scream because I was like, this is not helping. Like, if you say that one more time, I'm going to tear my hair out. And I wasn't getting any better after many months. And so I finally just said, listen, you know, it's nothing against you, but this isn't working for me. Like, we did not have a good therapeutic alliance. So that's, you know, really important. And tracking patient outcomes. You know, one thing that can be frustrating when you are working with someone who has chronic disease is that there sometimes aren't instant results. You know, we talk a lot about how, unfortunately, in behavioral health, it's not as simple as, breaking a leg, taking an x-ray, you know, getting casted, leg is fixed. You know, it's nuanced, everyone is different. The treatment is never going to be exactly the same patient to patient, and the progress can be different patient to patient. So if we can, and there are many tools out there, different tracking software, different healthcare tools that can help us, you know, different evaluations that can help both the patient and the therapist track progress and track, you know, what's helping and what's hurting. And I think that's really important, because I think if you talk to a lot of people, particularly who are early in their recovery, you know, they might say, no, I don't feel any better. But if you then can show them their assessment tools to say, well, listen, you know, a month ago you came in and you were feeling, you know, this way, and now this assessment that you just took shows that actually you are feeling a little bit better, right? And so it can tell you that you're on the right track. Conversely, if, you know, these assessment tools are not showing progress, or are showing that, you know, there's some kind of remission, then you know you can change tactics. So, you know, everything that we've talked about today is really universal and should be universal to anyone providing treatment to those struggling with alcohol or substance use disorder. Certainly, obviously, RCA, Recovery Centers of America, follows evidence-based programming because we know that as of today, this is what science tells us is going to be most effective. Does that mean it's perfect outcomes for everyone? Of course not. Again, it's, you know, this is a nuanced thing, and it's changing, and, you know, hopefully science is changing and will continue to change. But this is something that obviously RCA tries to follow. So, you know, our programming tries to address all of the biopsychosocial factors of addiction. The programming is tailored to individuals and where they may be coming to us from, in terms of whether or not it's their first time in treatment, whether or not they've had multiple treatment episodes, or whether or not they have some sort of co-occurring mental health, trauma, or medical issue. RCA does offer the full continuum of care, which we talked about is really important, including alumni support and connection to other support groups. You know, RCA is really committed to the use of medication-assisted treatment for all patients, but particularly for those struggling with opiate use disorder. We use a tool called Owl Health for patient outcome tracking, but again, there are others out there. So if you are a clinician and you're not using a patient outcome tracker, that might be something that's worth looking into. You know, we do weekly session audits to talk about how that therapeutic alliance is going. And then obviously we have ongoing training for the clinical, medical, and the outreach team, which we all know is super important, because things are always changing. The information that we have as a community is always changing. So some of the other things that can be important in treatment are, you know, using, you know, skills and DBT, CBT training. One question I had when I was going through this training is, why is so much of recovery group-based? That was something I didn't know or understand, not being, you know, a clinician. And, you know, what I learned was that that's primarily because addiction is a disease of isolation. And so it's meant to help foster connection, to kind of feed back into, you know, hopefully that continued care that will last for a year or more. Family education and support is something that's so important, and something that is often missing. You know, when families can also speak the language of recovery, then we have a better chance at supporting the patient. So anytime we can get families education and support, I think it's really important. And there are lots of different tools out there that we can use to do that. Obviously 12-step or other, you know, smart recovery, celebrate recovery integration, and then again, medication assisted treatment. So again, RCA specifically does offer all different levels of care. But the thing that, I want you to take away from this is really just what options are available and what we should aim for, whether a person is getting treatment, at RCA or ECS or Serenity House. Really this applies to any treatment center. So then one thing that, we did see in the NIDA principles of effective treatment was that treatment needs to be readily available, right? We talked about the ROSC referral network. And if we had time, I would go into like the nitty gritty of the admissions process and how it typically works at treatment centers like RCA or at the hospitals. I don't think we have time to do that today, but I think that's really important for families to know and understand. So, one thing that RCA does is, right, we're 24/7. We can assess and admit. And a lot of places are like that. So, you don't necessarily have to wait. If it's 2:00 in the morning and that's when someone's asking for help, there are options out there where you can move quickly. RCA offers free transportation. There's typically transportation that's available through, Medicaid insurance. And then there are also some peer supports that will sometimes offer transportation. So, if someone says to you, well, I want to get help and transportation is not available, there are options there that we can utilize to help. Most insurance you can use to cover the cost of treatment. Again, whether it's with RCA or with a hospital system or, with somewhere else, if you, have commercial insurance or state funded insurance, there are options available. Obviously with state funded, it's more limited sometimes, or there's a waiting list. But cost, hopefully won't be that barrier. And even if you are someone who is, unfunded entirely, there are options. Again, they're not always readily available, but that's something that the ROSC referral network works to break down and find those people the care that they need. Interventions can be helpful. There are lots of ways that interventions can be accessed. RCA does them, but you can also, ask, again, peer supports. You can ask sponsors to intervene in cases where, the person is maybe just not ready. Pregnant women, it's hard to get pregnant women to access higher levels of care because they're afraid of what the repercussions might be. But many places, including RCA, are able to accept pregnant women and they can safely detox them, safely detox the baby and get them treatment so that they are on their way to recovery. And are, enveloped in the recovery process when their baby is born. And then a lot of programs offer work or school flex. So whatever the barrier to treatment is, there, will hopefully be a program out there that, can work for that patient. Many programs offer virtual programming, virtual support groups, virtual individual therapy if someone is homebound for some reason. So really just, helping to remove those barriers to care can be really important in the journey to recovery. And that's really what I have for you guys today. Does anyone have any questions off the bat?
Yeah, thank you, Nicole. Ever you get a virtual round of applause? I see Astrid clapping. Thank you for that. And yeah, we do have a couple of minutes here. If anybody has any questions, you can put up your tiny virtual hand on Zoom, or you can just unmute yourself. I just wanted to say, Nicole, thank you for always, we've spoken about this before too, which is, really treating this as a true disease model and what comes with that, meaning the stigma that's related to it. And I'm somebody who, has been through some medical issues that are not related to substance use. And I don't have stigma that's related to that. right? The treatments that I went through for that, nobody looks sideways at me when I talk about that, but there is still stigma attached sometimes when I talk about the substance use and the recovery. So thank you for always bringing that up, because I think that is, you know, super, super important, but thank you again. Does anybody have any questions or comments for Nicole, either online or in person? I got one. Felicia Maselli, everybody. Let me give her the microphone.
Hi, Nicole.
Hi, Felicia.
With evidence-based treatment as far as MAT, is methadone still a very viable option, or Suboxone is taking that territory over?
I mean, I would say, and again, I'm not a medical professional. We see both, right? And they're different medications and they work differently. And so I think, you know, there is sometimes still more of a stigma associated with methadone. It was kind of the first, right? So I do think in some ways, you know, some of the medications that have come after, you know, are, you know, more tolerable. You know, just like, but then for others, you know, I like to compare it to antidepressants, right? Like there are lots of new antidepressants and some are more effective than others for people. But then, you know, like the OG Prozac, you know, sometimes that works for people really well. So I wouldn't say one is necessarily better than the other. It's just a matter of, you know, what is going to be most effective for that person's body chemistry and biology and for kind of what they're seeking in recovery.
If I can editorialize briefly, I think, and I've talked about this for the past year, I'm still waiting for someone to come present on methadone for me, because I think that methadone still does get a lot of flack, and I understand why. There's a lot of cons while there's also some pros, but I think there's also a lot of people who have remained off of opiates because of their methadone maintenance programs. So I think while Suboxone might be a little bit more tolerable, you know, as you put it, I still think methadone should be a viable option for certain clients. I definitely think so.
And in DuPage County, we have at least 2 methadone clinics. So I think, I don't know if she hopped off, but at Stony Brook, I believe they can administer methadone. And then there's also another methadone clinic in Downers Grove called CAP. And they administer as well. So there are options, you know, if that is what a client needs. And there are also, you know, I think sometimes the problem with MAT treatment is that people think, well, it's just, you know, you're just going to get a medication and you're not addressing the other issues around the substance use. And that's actually not true. So in most programs, you're getting the physical medication, but you're also getting group and individual therapy. And there are people who come to RCA, and I know there are people who go to these other treatment centers as well who you know, remain on methadone, but they want a higher level of care. So they're getting more intensive individual and group therapy because they want to make sure that they don't, you know, they don't return to their prior use. So yeah, I think all medication, and this is what the science is bearing out. If you talk to, you know, addiction medicine doctors and people who study this, is that medication is really effective. And so, you know, why wouldn't we use it? We use it for everything else. Why wouldn't we use it for, you know, substance and alcohol use disorder?
Agreed. We're right up against it here. So I do want to just thank you again. But I do, and if people have to jump off, we understand. But we also like to offer, you know, a couple of minutes to maybe promote events or programs that are going on. So this is that time for anybody, whether in person or on the Zoom here. Are there any upcoming programs or events anyone would like to promote here in the time that we have left with each other? You know what? Next month, I'm going to start calling on people. I see Scott Kaufman. There he is, folks. Go ahead, Scott.
In my finest hoodie. So I first of all, thank you so much, Nicole. That was a great presentation. I wanted to make mention of the health department's Narcan mail-out program, the DuPage Narcan program's mail-out program. In 2023, we mailed 781 kits through that program, which we are able to mail to any Illinois resident. They do not have to be in DuPage County. So 781 was great. The community center itself had, I think, 784 vending machine kits taken. So if my math is correct, I think the ever-present race between, oh, sorry, it was 884 kits at the community center. So over 1,500 kits between the two programs. So we're happy to see that. We know that there are many more at the new vending machine at Glendale Heights, at the wall units that are being installed throughout the county. I'm going to put in the chat this new map that we're working on that has the locations of those free Narcan machines, but just wanted to mention that their Narcan distribution is at an all-time high, and we're shooting for even higher in 2024.
Great work, Scott. Thank you very much. I know everybody's got some time. They may need to jump off. I did want to promote real quick the next DuPage ROSC Council meeting, which will be next month. It's always the second Wednesday at 3 p.m. if you ever have any question on when it is. And this Zoom stays the same. So you can always just use this in the future if you somehow misplace something. Next month, we actually do have Jim Wilkerson, who helps head up the state's gambling initiatives, is going to come on and talk about some of the work that they're doing, which we are seeing crossover more and more with substance use, more and more people showing up, not only with, traditional gambling, but with sports gambling and online gambling, you name it. And then in addition to all the wonderful stuff we do at ROSC meetings. But last thing I'll say, you're more than welcome to come in person. We always have a great group of people. If you show up, I've always got Narcan, fentanyl, xylazine test strips to take home with you. And it would be great to see you in person. So thank you, everybody, for showing up. Thank you again, Nicole. And again, if you want to share this meeting, it'll be up on YouTube within the next couple of days. And I'll stick around here for a minute if anybody needs to talk, but otherwise we will see you all next month. Thank you for coming.
Thank you for having me. Thank you, everyone.